These blockages required surgery with general anesthesia and long incisions. Today, there's a new way to treat the problem of carotid artery disease in some cases. A simple procedure uses a small needle stick in the groin, and a guide leads a tiny cage-like stent to your carotid artery, where it expands and restores blood flow. You remain awake, and recovery time is much shorter. Who can you trust to know the signs of stroke and use the latest technology to stop it? Cardiovascular Institute of the South trains doctors from around the globe to perform this latest procedure to treat carotid artery disease. Cardiovascular Institute of the South, trusted by physicians from around the world, trusted by people like you. Call 800-425-2565 or visit us at cardio.com.
Welcome back to our live call-in show from Opelousas General as well as Cardiovascular Institute of the South. Tonight we are talking about the top 10 things, and we'll probably be touching more than top 10 things here. We're primarily dedicating this show talking about adapting some of the healthy habits, including eating right, exercising, and really containing it to more of a preventive mode here and go on during these holidays to remind our audience to stay. Of course, we all have to splurge a little bit, drink a little bit, eat and drink and enjoy the holidays. But nonetheless, we all have the responsibility, even if you eat well, eat a little much during the holidays, we have to revert back. The whole thing we're talking about is not just a fad. It's not something you do 1 week, 10 days, or some 3 months to lose weight, and then you're back to same old habits. The goal is to just kind of unlearn some of the bad habits and try to get on the track and get on and making small changes that you can stick to and continue doing that. So on this token, we are talking about some of the 10 things, and just kind of went on talking about different things, setting up some of the simple practical tips and tricks, how to go on and buy groceries, and what to do, and we talked about some of the obesity issues, and talking about the workouts and this whole deal. How do you go about creating a plan which is practical, which is not intimidating? When you advise a guy like me or somebody else that walks in who is 65 years old, who has had a heart attack, they come in there, how do you start motivating them?
Well, it gets back down to, first of all, looking at a schedule and what's realistic today. You know, when I plan a program design for people, I always ask the question, okay, right now, if you had to say what time of day would best work for you to fit in a regular routine, there's not any eruption, no one's going to be pulling at you, things are not coming at you sideways, when is that? And in most cases, we're going to find more success if you can do it first thing in the morning. I really think that. And Dr. Arzola commented on the time about the military, how they get up first thing in the morning, they do the exercise, and then they go through their drills. You know, they wake up every morning and start out with a mile run and exercises and so forth. I find that to be most successful, and that's pretty much what I do. I'm pretty much a 5 o'clock, 5:30 wake up, drink my coffee, do my meditation, do my prayer, and then after that say, Lord, help me get through these next 45 minutes because I know I got to do it. And it's a hard act to follow, man. If I'm going to go out there and teach, I got to kind of lead by example. And but I get in my 45 minutes a day, and that's probably a little more than the average person really needs. If you could get anywhere from 10 to 30 minutes on a regular basis, 5 to 7 days a week, I think it's a great program to start out with. And you start slow. You said it first. We talking about, you didn't wake up yesterday and all of a sudden go, God, I'm overweight, I'm fat, I'm 50 pounds. You know, it just happens slowly, slowly. So it's going to be just a slow process taking off. It can be quicker, but it needs to be at a very healthy state. I usually use the 500 calorie deficit formula, and that's pretty simple. If you take your body weight, guys, let's say I weigh 200 pounds, and a male, I use 12 calories per body pound. So at 12 calories at 200, I could consume 2,400 calories a day and pretty much maintain my body composition as I am. That's kind of like doing my regular daily routine. If I want to lose weight, then I would consume 250 calories less of 2,400, and then I'd exercise for 250 calories, which is about 30 minutes of vigorous exercise. Now I've only exercised 30 minutes, and what have I done? I've taken out 250 calories. Let me give you an example of 250 calories. 1 bag of regular sized potato chips, 220 calories, okay? So cut out 250 and add 250 exercise, that gives you 500. Over 7 days, that's 3,500, which is what? 1 pound of weight. So realistically, a person could get on a 250 deficit, 250 exercise, stay on that program every week, and in how many weeks in a year?
52.
We could lose 52 pounds in 1 year in a very safe and effective way. And that's
Extraordinarily practical. You
it's
never,
very
that is incredible that you are in that business of really looking at it in that view. But I think setting goals, and like we started off, and well, I'll interrupt it briefly here and take a call from Charles from Opelousas on line 1 here.
Hello, Charles. You got a question?
Yes, sir, I do. Matter of fact, I have a couple of questions. I have been going to the doctor having physicals 10 years or better. I'm 61 years old. All my cholesterol count has always been good. Like the good cholesterol was like in the 70s, the bad in the 50s. But I ended up, matter of fact, on the 12th of last month having a mild heart attack. One of my vessels was 75% blockage, the other one was 80%. And I ended up having to get some stitches. It didn't last very long, the heart attack. Maybe a minute the most, and it let go, which was very fortunate for that. But I was wondering, how did that happen?
Well, that is the age-old question.
And I think the audience heard this, and Charles is very healthy. It sounded like 61-year-old male who has done things right. He's been following with doctors and not really in a whole lot of medicines. His cholesterol is in great shape. But nonetheless, he had a minor heart attack that required a little bit of stenting. This reverts to our discussion back to that original gene pool business, right. And what are the things that, God-given, nature or other things, if he is a diabetic, if he has high cholesterol, which he didn't. In spite of it, of course, genetic makeup has a significant impact on the progression of atherosclerosis and blockages.
So we have to think about, remember, coronary artery disease is multifactorial.
That's the point.
What you bring from the factory, which is what you're built in with, in other words, what your parents gave you, what's your inheritance, what's your DNA, and what you expose your body to. Did you exercise every day? Did you eat appropriately every day?
High fiber.
Did you do what you had to do all your life? And even when you do all those things, there are things you cannot change. You can't change your parents. It's what came from the factory. That's why it's important to know their health conditions so that you can prepare yourself for these things. And sadly, what we do out there, the basic lipid panels that we use, don't always expose what the risk is. And many a times you have to break it down because not all LDL is the same. There are about 5 different subspecies of LDL. There are about 5 different subspecies of the HDL. LDL is the bad cholesterol, HDL is the good cholesterol. So having a high good cholesterol doesn't mean you're going to be protected. Sometimes it's not the good HDL that you have. And that came from the factory and how you expose your body to these things. So it's not as simplistic that I did everything I was supposed to have, so now I'm supposed to get the reward. No. The problem is what your inheritance gave you, and you did everything you needed to do. If you hadn't, it would have occurred 10, 15 years earlier.
You'd have been 41 and having those
That's right. I think neither should he be discouraged that, that
it's not the end.
It's a good thing that, good thing, it's not a good thing that he had an event, but the fact of the matter is, it's a good thing that he adapted to all these healthy habits all this time. Had it not been the case, things would have been worse.
Correct.
Yeah. So I think you should not feel discouraged, and he should continue engaging in all those healthy habits, and likely probably step it up a little more. Unfortunately,
look at the fiber content,
I
think, and look at your nutrition, and then again how much.
You can always tweak it. None of us and all of us can vouch for it. We all try, but it's not perfect. We can always try to make little changes that we can adapt to. Clay, you were about to say something.
Yeah, kind of continuing what Dr. Orsola was talking about. It's very frustrating to patients like Mr. Charles who feel like they're doing the right thing. They're probably much better than average about taking care of themselves, and still have something going on, i.e. a blockage or something. But you got to understand, medicine is still as good as we are. It's not an exact science. You got to look at it like it's the iceberg. You see the tip of the iceberg. That's what we know about vascular disease. There is so much that lurks underneath that we really still don't know about, that we're doing trials and investigations in universities, and Dr. Vereen's doing a lot here in Opelousas. But there's just still so much that we don't know, that we just so much focus on what we do know. And we do know that people with high cholesterol generally have more vascular problems than those who don't. It is not a cut and dried situation, and as Charles can attest to, his was good, and he still had some blockage develop. But so I want everybody to kind of take home that message is we focus on what we know. We're learning a lot more day to day, year to year, but the main thing that we do know is what we're talking about right now, is that a healthy lifestyle and healthy living and is as good at taking care of yourself as all the interventions and pills and all
the
that
fancy
we
things
can do.
together. Absolutely, no question about it. All these have a role, but really bulk of it are the simple measures that we could take and avoid and save themselves, as well as the whole healthcare business, this whole industry, a juggernaut of a thing, millions and billions of dollars. So the rate at which we are going, I mean, there won't be enough money on the planet to go on and do everybody weight loss surgeries and everybody take all kinds of cholesterol medicines, everybody get a stent. It's not going to last. It's not the way to go.
Taking personal responsibility.
It is all about responsibility. It should not be viewed as a big task or a burden. It's just your own life.
Right.
And here we are. We have one more caller, Selena from Opelousas.
Hello, Selena. Hey, you have a question?
Yes, I forgot my doctor name. I'm watching him on TV. I know I'm supposed to go back to you, but I'm overweight and it's making me breathe funny and I be short-winded. Can you tell me what's causing that?
Well, you know, she's one of us, and she answered part of the question. Selena, not to mock at her, but she had said that her weight is not perfect and she struggles with difficulty in breathing. And she sees some of us, I'm sure, for blood pressure or probably some other heart-related conditions. Talking about it, we touched upon that in the beginning. Being overweight simply leads to multiple problems, including your body is working extra hard to circulate, to oxygenate or supply air to the body when you're overweight, when there is so much redundant weight. And your body, your tissues are less sensitive to the insulin or the hormones secreted, which makes you more susceptible to develop diabetes. You're more susceptible to get joint problems and get premature arthritis. I've seen patients in their 40s get joint replacements.
Right.
At the same token, you have these 80-year-old little Cajun men, little French people walk in there, they're brisk, thin as ramrods, they're 80, 90 years old, they're bright, their skin is shiny, they're strong. Simple stuff like, and again, blood pressure, strokes, I mean, you name it. And cancer risk among women, including breast cancer, including colorectal cancers, are all being linked to eating, again, bad eating habits, eating processed foods, eating too much red meat, not eating enough fibers and enough. So it goes on. We can go ahead and, in fact, tie back every possible illness that we see in some form or fashion to eating bad and not exercising.
Even
simple as
orthopedic
that.
problems.
Every possible thing, my problem.
And the interesting thing is, it's the two cheapest things to do to prevent problems with your health. Exercise and eat appropriately. And the other thing that you can do, not only eating on the periphery that you were talking about, going in the supermarket, going around the periphery, is take a list of what you need.
Yes.
And do not go to the supermarket hungry. If you go hungry without a list and you go to the middle, you're in trouble.
Well, that's what Mike was talking about, meal planning. If you really specifically say,
This is what I'm gonna keep in my cupboard, because I'll tell you, if you keep the chips and the cookies and Oreos and stuff,
You're gonna eat them.
You're gonna eat them. If they're not there, you can't eat them.
Correct.
You can't eat them.
You can reward yourself once in a while, but that should not be a pattern. Even starting from children, even we see that these habits are all cultivated from
And
a
let's
very
talk about,
young
you talk about
age.
children. Let's say one thing that I can tell you in this world of fast food today with the children is carbonated drinks and water consumption. I mean, probably 70% of our population is walking around dehydrated. When you
can see
feel
my
like
water right here.
Yeah, when you can, like right now I'm thirsty, and I know that just being thirsty, I'm already dehydrated. I had a pretty busy day today, and I haven't drank enough today. And people ask me all the time, how much water